Forum för Health Policy söker bygga upp en plattform för samtal och erfarenhetsutbyte kring styrning, ledning, utveckling, hälsopolitik i vid mening, kring de frågor som står framför vårt sjukvårdssystem. De viktigaste utmaningarna kring vårdens framtid. Vår tanke är att bringa samman expertkunskap inom relevanta fält från forskningen med beslutsfattarna i vårt sjukvårdssystem. Vi arrangerar ett antal workshops, halvdagsseminarier, väl förberett kunskapsunderlag av svenska experter och en internationell expert. Jag vill välkomna David Ostrow till det workshop som hålls kring styrningsfrågor, ekonomisk styrning och kvalitetsmässig styrning av vården. 2 redskap som börjar användas i svenskt sjukvårdssystem, och de erfarenheter som David Ostrow har från att leda Vancouvers universitetssjukhus är en viktig grund för Forums workshop kring de frågorna. Välkommen David. You're most welcome here.
Thank you, Johan. It's a pleasure to be here in Stockholm, and it's a pleasure to be able to share with you some of our experiences. Let me give you a quick background. I am the President and Chief Executive Officer of the Vancouver Coastal Health Authority. I'm also Professor of Medicine at the University of British Columbia. We have a budget of about $3 billion Canadian. We care for the primary, secondary, and tertiary care needs of the city of Vancouver, and also the tertiary needs of the province of British Columbia. We have a primarily public system in Canada, and so we're very similar to Sweden. And like Sweden, we have come to the conclusion that our current funding mechanisms, our current methods of operation are not sustainable for the long term. And this has led to us to believe that we can improve outcomes for our population through innovation. And I've come to share with you some of those innovations. We're obviously still in the early stages of that, but I think they're interesting. One of the things that we've learned is that we will share ideas from everybody, and we search ideas all over the world. And what I would like to specifically talk with you about are things like paying for specific quality outcomes that you want. And also I'd like to talk to you about not paying for outcomes that you think are inappropriate. And those are 2 elements of the conversation that I think might be interesting and provocative for your Swedish audience.
David, obviously a key part of your experiences are motivation factors. Could you tell us what are the strongest motivation factors for physicians? Is it money, is it professional prestige, or is it sort of internal motivations factors like ethics and doing good?
Well, I think like all professionals, physicians, nurses, other healthcare professionals have an internal motivation to do the best job, to have the best outcomes for their patients or clients. But money is a very important factor, and in fact, certainly in organized medicine, we see that how money is used and distributed is a very important motivating factor.
So it's an issue, I suppose, of sort of mixing. The professional drivers are also very strong, I think, with professional people in healthcare. But money should not be neglected.
Money can't be neglected. The goal for us as healthcare leaders is to find a way to align our values and outcomes with those of the physicians to produce better outcomes for our patients. Sometimes it's difficult to ensure that that alignment is in parallel.